Good afternoon, everyone, and welcome to the American Prospects Forum on the Public Transportation Systems in Crisis. I'm Gabrielle Gurley, Deputy Editor of The Prospect, and I'll be moderating conversations with a few of the country's top public transportation leaders. They're going to break down the challenges of the last pandemic year and share their views on the issues facing Americans who use bus, subway, paratransit, and other networks as we begin the transition into a new normal. But first, to offer opening remarks to help us frame that discussion is U.S. Representative Jesús García. He represents the 4th District of Illinois, which includes the vital Chicago transportation hub. First elected to Congress in 2018, Congressman Garcia is a member of the House Transportation and Infrastructure Committee. He's fought to include funding for transportation agencies and their workers in COVID-19 emergency relief packages, and is a co-founder of the Future of Transportation caucus that promotes solutions to sustainability, equity, and access concerns in transportation. His priorities in Congress this session include advancing the transit parity resolution, a first step in ending the funding disparities between highways and public transit, and also working on a historic infrastructure package to rebuild U.S. public transit roads, bridges, and airports. Welcome, Congressman Garcia.
Thank you so much, Gabrielle, for the introduction. Taking a little pause here from a Transportation and Infrastructure Committee markup meeting, as a matter of fact. I am the representative of the 4th District from Illinois. My home is a multi-ethnic working class district that is over 1/3 foreign born, including Mexican-American and Puerto Ricans on the southwest and northwest sides of Chicago. Many of my constituents don't own a car. We're a community that relies on public transportation. For my constituents, public transit isn't an option, it is a lifeline. At the beginning of the pandemic, when we started to get the stay-at-home orders, it highlighted how many of our essential workers are dependent on public transit. But we also saw ridership decrease as many non-essential workers stayed home. Cities and states were forced to make hard decisions that they were unprepared for. Transit services were dramatically reduced, or in some cases, entirely stopped, leaving millions of essential workers stranded. But the COVID-19 pandemic was just a magnification of our failing public transit systems. When transit ridership dipped, municipalities cut services because they couldn't pay for them. But we didn't see these turnpikes shut down because there were lower tolls. We didn't see bridges limit traffic. We need parity in how we view public transit and driving. We need to move away from the idea that public transit must pay for itself through fares, and understand that just like highways, we need Congress to step up and provide public transit systems that need the funding to provide services that people need. We all accept that the Highway Trust Fund is antiquated and no longer covers the cost of our roads and highways. This is evidenced by numerous occasions where Congress has had to transfer general fund money over to repair our roads and highways. But somehow, public transportation must pay for itself, or it isn't viable. I don't know how many parents we have watching today, but I know that if one of my kids came home with a D-, we would sit down and talk about what was going on, why they weren't doing well, and what changes we needed to make so that they could better understand the material and improve their grade. Similarly, we need that type of treatment for our public transit systems. We need to find the courage, not just to update and tweak around the edges of the Surface Transportation Reauthorization Bill every 5 years. Instead, we need to take a look at where we are failing and make the real change so we can get an A+. Transportation policy has become too formulated, and we have too few experts in Congress who know enough to challenge the broken status quo. We must move away from the old formulas and policies and funding and embrace change. When the Highway Trust Fund was created, hybrid cars and electric vehicles were things of science fiction. And for too long, we've been accepting the Highway Trust Fund to be a split of 80-20, where 80% of the funding goes towards roads and only 20% goes to public transit. The 80-20 split is one of the biggest problems facing public transit because no matter what work we do, sprawl will always win because of that formula. And that's why we created the Futures of Transportation Caucus in Congress to educate ourselves, our colleagues, and our colleague staff to understand the formula, to challenge the formulas, and to envision where we need to go with our transportation systems. Let's take an example, the chicken or the egg example. Folks argue that we have a lot of roads, so we need to plan our policy and funding proportionately. The result, we find more highways and roads and less transit. And the cycle is perpetuated, and transit continues to look less and less viable. Now, let's flip the narrative. If we invest significantly more in transit, all of a sudden, developers in the private market will go where the money incentives are. Transit-oriented development and more transit lines. With time, you get denser development, more transit, and significantly greener, more affordable, walkable cities and neighborhoods. We have to make sure that folks understand that it doesn't have to be a zero-sum game with highways competing for the same pot of money as transit. We need to move away from the broken formulas that were written at a time when redlining was in full swing. Let's not forget the deep scars our urban landscapes bear, with the physical segregation along racial and socioeconomic lines with barriers like highways and train tracks used to carve up Black and Latino communities especially. Let's also not remove from the conversation the inequity of hinging job, healthcare, and educational opportunities on the need to own a car, which, according to the Bureau of Transportation Statistics, can cost someone upwards of $8,000 a year. We have an opportunity ahead of us. With the new administration focused on building back better, a secretary laser focused on equity, and a unified Congress to change the way that this country looks at public transit and public transit funding, so we can avoid finding ourselves in the same ditch 30 years from now. It's time to re-examine our transportation policies and finally treat public transit, or the lack thereof, as the social justice that it truly is. Thank you again, Gabrielle, and I look forward to learning more from the great panelists you've put together. This is going to be a really great event. Thank you, mil gracias.
Thank you so much, Congressman Garcia, and hopefully we could get some answers to move our public transportation systems from a D+ to an A+. Thank you again for joining us, and many thanks to your staffs in the 4th District and on Capitol Hill.
Thank you.
Up next, and joining us on our first panel, are 3 transit leaders who've worked to keep their systems running during the pandemic, balancing the needs of the riding public with the safety of transit workers. And now they are also assisting their communities with vaccine distribution. India Birdsong is the general manager of the Greater Cleveland Regional Transit Authority. Barb Klein is the executive director of the Prairie Hills Transit Authority, transit agency, headquartered in Spearfish, South Dakota, in the Black Hills region of Western South Dakota. And Julie Kirschbaum is the director of transit for the San Francisco Municipal Transportation Agency. Welcome to all of you. I'm going to direct the first question to India Birdsong, and we're going to open by talking about a vaccine distribution and how transit is working with community partners to get people to those vaccination centers, assuring that they can get in and out of those places quickly and safely. India, tell us a little bit about what you are doing in the Greater Cleveland area.
Sure. Good afternoon. Thank you so much for having me, and I'm happy to talk about this. It's a very important subject matter, and here in Cleveland, we actually have had a really extraordinary opportunity to provide free transport to those individuals in the community that are looking to travel to vaccine sites. We have what's called a Max VAC here in Cleveland, which is part of Cleveland State University, and they're utilizing their campus in order to kind of provide that environment for vaccinations for thousands of people in Ohio. So we actually have partnered along with ODOT, the Ohio Department of Transportation. We were the recipient of a $772,000 grant that has provided us the financial means to be able to provide this transportation. We're going to do this for 8 weeks. So it's going to go through basically the beginning of May. And I believe that we are somewhere just under 1,000 rides so far. And we've only been doing it for about 5 days. So it's definitely something that is needed in the community. We're also partnering with the county to be able to provide up to 10,000 passes. These are one-day rides, so back and forth to vaccine sites all throughout the different communities, different colors, shapes, sizes, everyone you can think of when their turn comes up. And then we also are providing free transit on paratransit for our wheelchair customers and other folks that are taking paratransit to be able to take vaccine rides as well for free during this time period.
So let me turn to Barbara Klein in Spearfish, South Dakota. Tell us a little bit about what your system, Prairie Hills Transit, is doing for community members as far as the vaccination process is concerned.
Certainly. Prairie Hills Transit is a rural transportation system operating in a 12,500 square mile area. So our opportunities are a little bit different. One of the communities that we provide service in is very close to the North Dakota border, and the early vaccines were only offered in the county seat, which meant that many of our riders needed to go about a 45-mile trip to get those vaccinations. So early on, we moved those individuals from one community to the county seat for their initial vaccination and their second one. For the remainder of our system, it hasn't been quite so difficult, and we've offered free transportation for anyone that needs a ride to get vaccinations. So it's been a community by community opportunity for us to help those individuals.
Okay, so Julie, in San Francisco, give us a sense of what Muni is doing to move people to these different sites.
Thank you. We are following a very similar program to Cleveland. We are providing all of our customers a free transit to and from vaccine sites for their first trip and for their second trip,
Mhm.
as well as on our paratransit system. We also had a program that we stood up during COVID called the Essential Trip Card, which allows seniors and people with disabilities who don't qualify for paratransit, but who may not have their regular transit route operational right now,
Mhm.
purchase taxi fare at a very discounted rate. And so we've allowed folks to double how much they're purchasing in order to cover taxi fare to and from the vaccine site. So really trying to have a variety of options because people's travel patterns are so different right now, and trying to recognize that.
Yeah, now we are in this more hopeful phase of the pandemic, that we are actually have a solution in progress, and obviously your systems are helping move people to those centers. But it wasn't, it was just a year ago that many of us were in the midst. And I know, Barbara, for you, it came a little later in the crisis than it did for those of us on the coast. Tell us a little bit about one of your big challenges, which was transporting discharged COVID patients, COVID positive patients. How did you handle that, and what did you learn for that experience?
We were approached by a healthcare contractor that we have provided service and worked with for about 10 years. But one of the challenges that they faced was finding enough manpower to be able to get individuals discharged from the hospital and getting them either to off sites where there wasn't quite so much care required, or in many cases, it was hundreds of miles to an individual's home. And what they needed was to make sure that we had somebody that was properly trained, was able to use the proper PPE, and had a vehicle that could accommodate that. So we specifically had a driver that was set to take all the COVID positive discharges that they needed to get out. By doing that, what it did was it also allowed the ambulance services to focus on what they needed to be doing. And it also eliminated the need to divert some of those patients to larger hospitals or hospitals miles and miles and miles away. But it was, and it still continues at a much smaller percentage right now. But one of the challenges in doing that was that when we took discharged patients home to reservations or tribal reservations, they had set up roadblocks. So you had to be able to provide paperwork, prove who you were taking, where you were taking them. And so for us, when we got into those miles and miles of returning folks to their homes or to a different hospital that may have been more rehab, that was one of the major things that we encompass.
Right, there is a lot of concern in Native American communities all over the country because of being particularly hard hit. So I would imagine that they were being particularly cautious at those times. But it's obviously a challenge that you were able to rise and meet. India, can you talk a little bit about what your major challenge was during the early days of the pandemic and how you confronted it?
Sure. During the beginning of the COVID pandemic, I think that we were really tasked with how are we going to continue to provide service for our customers in a safe and effective manner without slashing too much of our service while we had not received the CARES Act funding yet. So we really started to think about how we were going to do that, and we really modeled our disinfecting program off of the New York MTA model. We thought about what's our biggest, competitor, so to speak, within the industry, and also how do they operate, understanding that they're triple and quadruple in size and frequency. So we started to look at how also to partner with other agencies. and business stakeholders. So there was a large problem with getting PPE, as we all have experienced. Understanding that we fall in line behind hospitals and nurses and doctors, which is to be expected, we still have to get those frontline employees what they need in order to do their daily jobs. So we thought about what businesses were actually going out of business because of everyone staying at home. And we actually started to partner with mask making companies, right, that became that, so dry cleaners and that kind of thing, to be able to make those. We turned a couple of our in-house upholster positions into actually mask makers through the pandemic. And we also thought about what disinfecting technologies were out there on aircrafts and hospitals, and we started to employ those technologies here in-house for public transit. So we've done a lot of things, I think, and a lot of firsts in the state. We also have utilized our engineering team and our maintenance team in order to come up with 2 and 3 different iterations of plastic barriers that we have put on all of our vehicles. So we're probably on iteration number 3 or 4 now, and utilize those kind of relationships with West Coast companies that actually provided the shell tops for convertibles, and utilize that kind of plastic in our shields. So we got a little bit better with time and more efficient. And I think it's really helped us be able to keep our numbers down.
Okay. Now, Julie, San Francisco had some really unique challenges on the financial front and on the maintenance front. How close were you to some difficult decisions because of the financial crisis that the system was in?
It got very scary. We got close enough that we were having conversations with staff and with policymakers about upwards of 25% layoffs. And it was heartbreaking because the people we were having these conversations with were the people that India just talked about, the operators and the mechanics and the car cleaners that got us through the crisis and were what enabled San Franciscans to get to hospitals and get to essential trips and get to the grocery store.
Mhm.
Our revenue streams have been hit so badly that we are really only surviving based on these amazing one-time investments from the federal government. So our world looked very different. At the end of 2020, we were having conversations about devastating layoffs, and at the beginning of 21, and now more recently, we're talking about not just stabilizing, but rebuilding, which is incredible, but also comes with its own challenges, because what we're seeing in the next 2 years is 30% of our operating budget coming from one-time sources, which is not sustainable. And we're still looking over a cliff. We've pushed that cliff out. It's bought us critical time to get on the ballot, to work with our voters, to work with our decision makers, but we need a sustainable source of funding, not just in San Francisco, but nationwide, if we're going to rebuild our cities and our towns.
So what do the American Rescue Plan funds do for San Francisco? And as far as other funding sources, what are you thinking about specifically?
The Rescue Act allows San Francisco to recover because we are a dense urban environment, and without the efficiencies of transit and walking and biking, we couldn't get people to the jobs that they need to return to. And so it allows us to rebuild our transit system and allows us to have time to explore what are our other funding options. And we're trying to cast a wide net because we want to make sure that we're solving our financial challenges completely. So we're looking at everything from infrastructure surcharges to sales tax to trying to invest in our own real estate and in some cases become developers on our very, very valuable land. So we're looking at all sorts of options to make our funding sources more stable and more sustainable than they are now.
So Barbara, let's talk about the funding challenges for a rural transit system like yours. What are you contemplating in the months and years ahead as you look at your balance sheets and think about what new ideas you have for funding the system?
We had understandably put several of our projects on hold, even ordering vehicles, because we weren't sure what size we would need or how many we would even need based on where we were at a year ago. So we have begun ordering new vehicles, and they are larger. We're at about 80% of our ridership compared to last year at this time, which is very optimistic.
That is optimistic.
For a lot of the healthcare entities, they're beginning to send people out again. So as far as being optimistic, we've got a couple smaller communities who again had transportation requests that they wanted to start. They're back on the fast track about when can we get a bus and get, drivers and so forth. So even though we're smaller percentage wise than we thought we would be, I think we're very optimistic that funding wise we can get back to where we were. The CARES Act helped small rural agencies tremendously. And I think not knowing what that holds as far as the American Relief Plan, I don't think we can, get too optimistic about that. Cautiously optimistic, I think, is what we would be. But ordering vehicles, starting new services, and ramping up some of the things that we kind of put on hold, we're back on track with. And so we're in a good place right now. Thank you.
So India, tell us a little bit about what's going on in the greater Cleveland area. I know you have some funding sources that some other systems just have not graduated to as yet that have helped you get through the pandemic. What are you looking for supplementary monies in the years ahead?
Sure. So we're looking forward to an investment, I think, by the state in public transit overall in Ohio. We've had some interesting conversations with legislators and representatives over the last few months about what the appropriate level of investment looks like for transportation. I think that because we have been stabilized a little bit, Julie mentioned it, Barbara as well, as far as the CARES Act and how much of a godsend that has been to the industry, it definitely is short-lived and it is moment by moment. It's not a guarantee year over year. So we're talking about purchasing vehicles and doing all of this. I think all of us are doing that, but your average lead time on a typical 40-foot bus is about 18 months, give or take. So it's difficult to be able to really plan and project over the course of 2 and 3 years when you're not really certain how much funding you're going to get year over year. So we're looking at budget cuts here in the state, and we're actually hoping to be able to reverse that course because we were told that we were to expect a 90% decrease. And that's 90. I have to always clarify that. So we're looking at reversing that, hopefully with the help of some legislation. We're also looking at track funding, which is our capital investment, right? We want to be able to get in the ring and box, so to speak. We want to be able to be eligible for grant applications for some of these major capital projects that we have in backlog. We've got about $500 million in backlog capital projects that we would like to move forward with. We have a $300 million rail car replacement program that we have probably found about half of that funding so far. And these are big ticket items because these are state of good repair. We've got to be able to continue to invest in ourselves so that we can be competitive with car culture when people are actually getting back into their offices. We want to be able to look at our system and think about our redesign efforts. So we actually have a service redesign project that we have continued to move forward with through the pandemic, and it will be coming online in June. So we're really taking advantage of this time, I think, to use a little downtime, right, and be able to think more logically and more comprehensively about how we're going to compete in the market when everything gets back to normal. So we're looking at opportunities for flex funding. We're looking at opportunities for capital investments and capital ventures. We also are looking at our real estate, as Julie mentioned, to see where we can actually help ourselves, and hopefully we'll end up on the other side a little bit better for it.
Well, you were all looking very closely at how you are going to serve the writing public going forward. Given that the vaccine process has started, we are seeing in a lot of areas businesses that had remained shuttered are opening up. Restaurants are starting to reopen. How are you getting people back to take transit? I know, Barbara, you said that it sounds like things are fairly healthy there. Julie, can you give us a sense if people are coming back to transit?
We are seeing a slow and steady return to transit. We are at about 30% of our pre-COVID ridership, but that's upwards of 200,000 boardings a day. So we're not where we were pre-COVID, but we're moving a tremendous amount of people by transit. Our biggest challenge right now being the capacity restrictions that the social distancing places on transit. So we have many of our routes that are by COVID standards too crowded.
Yeah.
And we're still in a position where we're leaving customers at the curb. We have been continuously reinvesting in our busiest routes that go by hospitals and grocery stores and major job centers, and we'll continue to do that. We've also set up a number of emergency transit lanes because we know that congestion is going to come back, and protecting transit so that people are on the bus for as short amount of time as possible, giving them a quick trip, being able to get as many buses in the system as possible with the resources we have is so important in this emergency time. So we are optimistic about our ridership, but it's going to take more people getting vaccinated and our rates continuing to get lower so that we can start to go back to doing what transit is good at, which is carrying big volumes of people in a single bus. And so we are optimistic about our ridership and do need to keep investing where we're seeing customers.
So Barbara, you were saying that your ridership is fairly robust compared to the really crisis choke points during the pandemic?
Yes. A lot of the loss was with school children and individuals at adjustment training centers. They were keeping people sheltered at home. Children obviously were being homeschooled, but all of the public schools in South Dakota have reopened. Class schedules have resumed, which are all good things. And just the 1st of March, the adjustment training centers have started moving the people they support from their homes or from their group homes and getting them back into more of a normal for them. So, and again, more and more people are traveling to the major communities for healthcare appointments or specialized healthcare. So our resumption for actual passenger transportation, we're getting people where they need to be. People are going back to jobs where their jobs are more essential. And again, things are opening up here. So I think South Dakota is one of those that has gotten a lot of publicity through the pandemic because of the way our governor managed things, and because we don't have the populations that you have in
Sure.
Ohio or San Francisco. But it's a good feel to get people back to where they need to be and see our passengers that we didn't get to see. I know the drivers have been just troopers through all of this because they're so excited to see their kids on the bus again, and their elderly folks are getting out, going to the grocery stores themselves. It's a good feel.
Mm. And John Costa with the Amalgamated Transit Union is going to be talking more about workforce issues in our next panel. India, can you talk a little bit about what is going on in Ohio? I don't know what the school situation is there. Perhaps you can tell us who are you seeing coming back to transit? Obviously, there are people who never left transit and have continued to travel back and forth.
Sure, we're actually seeing a slow crawl. So we're not doing as well as South Dakota there, but we are definitely doing a little bit better than we were. We are probably, we hover between 55 and 60% of pre-COVID ridership levels on a given day.
Mhm.
So we're normally about that half range. And that translates into our fare collection as well.
Mhm.
I do think that we're seeing a lot of people coming back into the downtown area, and that's a slow crawl. We have started to partner with our kind of downtown business chamber to be able to evaluate the vacancy rates through a lot of the residential areas
Mhm.
and a lot of the investment properties that are retaining a lot of those employees. We are, however, seeing people really plan to stay at home for the foreseeable future. And I think that makes a huge difference, especially when you're talking about state workers, if you're talking about people downtown that may not come in more on a predictable schedule. So we're seeing some of the social activities start to open up a little bit. Our ballparks, although they're not 100%, they're talking about opening back up for the summer. You're seeing orchestras and Playhouse Square starting to think about coming back. The school system was also working through a hybrid system of rotating students back in.
Sure.
So you've got a lot of that where you still have a lot of room on those buses and trains because they're not back fully. However, they're starting to kind of inch their way back in. And so that makes a huge difference for us as well. I think the essential workers, not just the folks who are working in the hospitals and folks who are working for us, but think about the waiters and the waitresses and the cleaners and folks that just do the invisible work, right? That you don't pay attention to until you don't have that service available, are starting to come back as well. So I think that we'll hopefully be in a pretty good position at the end of the summer. And I am optimistic to see our ridership levels at least get back up to the 60s and 70s percentiles, hopefully by year end, but we are crossing our fingers and doing what we can to make sure we have those services available.
Well, we've got about 3 minutes left, and that'll give each of you a minute to answer my final question. There were a lot of observers in the early months of the pandemic who were quick to declare public transportation dead, and that public transportation would just, wither and disappear. Is that your conclusion? How would you judge the health of public transportation today? Is it dead? Barbara?
Well, I like to think that we're pretty sturdy stock here in South Dakota, but we didn't ever go there. I mean, it was not ever gloom and despair. Our essential workers were working as many hours as we needed them to work. We also have a child care center in our facility, which Peter Rogoff could tell you about, but those folks were working full time. So we've always been optimistic that we're going to return to capacity or at least close capacity. And we've been here from the beginning. We didn't ever work from home. We've always been on site. So we're a thumbs up for moving forward.
Julie, are you a thumbs up for moving forward?
I am. We're of sturdy stock in a different way. But I love that expression. I think transit more than ever reflects the values of our city and the value of towns and cities across the country. Transit is about equity. Transit is about addressing the climate emergency. It's about connecting communities, which after the year we've had, we need desperately. And it's about supporting the economy as we build back and bring everybody up to an even playing field. So we're very committed to transit in this city and look forward to supporting transit across the country as it rebuilds.
India, we've got 30 seconds, so take us home, as it were.
I'll make it brief. I say you get out of it what you put into it. And basically, public transit has really taken advantage of this as an opportunity to show that we are essential and we're needed. And I think that if anything that we get out of this, we show folks that the invisible man, right, is important. You've got to be able to do the work and do it well. And if you do it well enough, most people don't even know you're there. And I think that's what public transit represents. And we'll continue to be there and also be innovative and prove our salt and our worth as we go forward.
India, Julia, and Barb, thank you so much for joining me this afternoon. It's been a great conversation.
Thank you.
Thank you. Bye-bye now. Next up, we're going to turn to workforce issues. Keeping transit systems running during the pandemic means that public transportation workers have made some of the biggest sacrifices and will be instrumental in seeing that we transition to the other side of the pandemic safely. Our next transportation leader is the head of one of the country's largest labor unions, representing more than 200,000 drivers, operators, mechanics, and other transportation affiliated workers in the US and Canada. John Costa is the international president of the Amalgamated Transit Union. Welcome, John.
Thank you, Gabriella. How are you?
I'm good. How are you today?
Good, good.
So give us a sense how ATU members have fared during the pandemic.
Well, it's gotten easier, I guess I should say, but not totally better. You know, we lost 143 members since the pandemic. Over 5,000 of our members have been affected. And, you know, tracing in the beginning was a big problem. Protection in the beginning was a big problem. Our members could not work from home. The agencies, I don't think, you know, understood the seriousness of it. My members working out there know the job. You know, they're dealing with many people. The infection rate was climbing, and it took, unfortunately, my members dying to get the attention of the politicians, along with the agencies, to see how serious this was, and demands from our union to say, you know, we're not going to be sacrificed out here. There was a mixed flow. You had to make a choice of, you know, do I go to work and make a living and pay my bills, or do I stay home in fear of being sick and bring it at home, not only to myself and possibly dying, but also to my family? I mean, I've lost friends. We have lost presidents, not only drivers and mechanics and clerical workers. It was a crazy and a very dying time in the beginning.
Have systems stepped up? Now that we're a year into the crisis?
Yeah, systems, they stepped up. You know, I believe our union, we put a command center together right away. We didn't know what we were doing, but day by day we were learning. But I knew that we needed to get information out quick to our locals. You know, we have 250 locals around the country. to get information on how we're going to treat this, how we're going to make demands. PPE was not there. The agencies that
Right.
were trying to get it couldn't find it, as your panelists have talked about. You know, a lot of our members took action in their own hands in our locals, and they provided the PPE and the situations with the buses with shields and cleaning the buses. And, you know, we took a position on demanding if you were not going to give us a safe bus, we were not going to take them out.
Last week, I believe it was Thursday, was Transit Workers Appreciation Day. And one way appreciation certainly happens is making sure that essential workers are vaccinated. What's happening on that front? Are transit workers being prioritized?
Not the way I would like it.
Hmm.
I had arguments with governors, chief of staff of governors that, you know, I don't understand how we're not essential. I don't know how we're not up on the front line. Let's face it, if our members are not feeling comfortable driving a bus, how are you going to get the riders on the bus? You know, if our members are sick, we're spreading it to frontline workers, you know, hospital workers, grocery stores, those that are given essential services. So it made no sense then. How do you put us behind and back the line?
What were the justifications they were giving for not considering you essential as far as vaccines were concerned? What were you hearing?
They try to use examples like, well, they can qualify just by going online anyway. You know, a lot of them, you know, are older, or a lot of them meet the criteria. You know, bus driver drives 12, 14 hours a day. They split shifts. You know, you want them to come home and get on a computer and get online. I mean, plus there was a fear about these vaccines, and not all of our members, you know, had a feeling. The Black community and the brown community were not, you know, told there was conspiracies behind this also, and there was fear about this. So instead of, you know, it made no sense. I mean, we had an agency that we can not only help distribute this and bring people to the vaccine sites, we can create our own sites right on our own properties where thousands of our members could be vaccinated. And you know, I was getting some really ridiculous, you know, excuses. And you know, my members are dying. You know, they're dying. I mean, the police were given a priority. The fire were given a priority, and they gave me well, they go in people's homes. Well, you know what? All our homes go in our buses. Yeah. You know, like my members are carrying homes. I mean, and you're going to take a position. So sometimes I listen to some of our leaders, and there's such a disconnect. But you know, others stepped right up. I mean, other governors, and you know, stepped right up, and you know, unfortunately, some were lied to. They said there was more, you know, the vaccinations were there, and we found out after this election that they weren't there. So there was complications. So it took a lot of arguing, fighting, and pulling them out. I mean, I'm tired of hearing my members are heroes, but then when it comes to distributing,
when it comes to vaccines, they're not.
You know, we're not heroes. You know, we're back of the line. You know, you could wait, sacrifice.
If you could point to a state or an agency that's actually doing this right, is there someone you could point to? If you could say, all of you governors who don't really understand our position, here's who you need to look to for some guidance on how this should work.
Well, New York was doing it right. We had California. They were bringing them right to the workforce. Recently in Missouri, Kansas City, they had the National Guard come right on our property, and we're vaccinating our members. That New Jersey was a little slow, but Governor Murphy came along, and after a couple conversations that were kind of like I explained before, but you know, they're finally getting the vaccines, and they're doing them right on the properties. So they're doing it right. Okay.
Just to wrap up, quickly, what are you most concerned about going into the new normal?
I don't know what a new normal is. I mean, everything's back to normal to me. I mean, in the beginning, we were heroes. You know, there was a lot of good talk. Our union fought hard in this election to get President Biden elected. We have one of the biggest transportation funding packages in the history of our country for transportation, $30 million. Hopefully more will come to change the industry. But what's the new normal? We're back to the old normal. Now it's time for contracts that are opening up and they want us to take concessions. You know, we're heroes, but we're zeros at the table. You know, they want to challenge, well, if we don't get this, you're going to have layoffs. They want to take away our overtime. So, you know, all the sacrifices that we made to keep the lines open, to keep people alive, and to build back the cities, because you're going to need us to build back the cities. You know, all of that is forgotten about, and you know, you want to take your funding off our backs. You know, and that's not the way it should be. I heard earlier, you know, I think her name was Judy, spoke about dedicated funding and funding sources. Yes, that should be the new normal, going there and not sacrificing my members' contracts and concessions and making us poorer, and you know, because of this pandemic. And they should step up and respect us. So, what is the new norm? What is that? I hear that all the time, and I don't see much change. I see the old norm come back as far as, you know, greed and trying to control their budget, you know, on the backs of labor.
Well, John, we've got 3 national leaders coming up in our next panel, and perhaps we can get some insight into the thinking as far as a workforce concerns, so that transit workers will continue to be heroes for those of us who ride transit and not zeros. John Costa, thank you very much for your candid observations.
Thank you, Gabrielle. Thank you very much. Hey, stay safe.
Okay, you do the same.
All right.
Next up, we're going to look at some big picture questions with our next 3 guests. With the vaccination rollout, some people are slowly coming back to transit. Other people plan to work from home exclusively and drive where they need to go. But it's important to underline that riders who never left transit will be continuing to utilize it and rely on it. Americans will continue to have options thanks to the passage of the latest COVID-19 stimulus bill, which sent some $30 billion to US transit systems. But as we mentioned at the top, the American Society of Civil Engineers has graded the US and public transit at a D-. And as Representative Garcia has said, we'd like to see that grade improve a little bit. So lest we forget, there are still plenty of challenges to overcome. Joining me are Dr. Beverly Scott, the CEO of her consultancy, Beverly Scott Associates. She is the former head of the Massachusetts Bay Transportation Authority, the Metro Boston system, and MARTA, the Metropolitan Atlanta Rapid Transit Authority. Peter Rogoff is the CEO of Sound Transit, the Metro Seattle system. He is a former U.S. Department of Transportation official, having served as Undersecretary of Transportation Policy in the second Obama administration and the Federal Transit Administrator during the first Obama administration. And Jared Johnson is the Executive Director of Transit Matters, a Boston-based advocacy group dedicated to uniting and informing transit advocates and the public. Welcome to all of you. Congress has managed to stave off the immediate fiscal crisis that many systems feared would overwhelm them. We heard from San Francisco, which is still going to have significant problems. So we know that the federal government's work is never done. Peter, I'll start with you. Where do you think the federal government needs to focus next when it comes to transit?
Well, first, thanks for having me. It's really good to be among this group and really great to see old friends again. As far as what the federal government needs to do next, I think we first need to focus on where the transit riders are now and really take a hard look at how commuting patterns may be changing and making sure that we have robust and reliable service, first, obviously, for the transit dependent, but also all transit riders to make sure that they can get where they want to go. Secondly, I really think the time is right. If it ever hasn't been right to really use transportation policy making to address climate change. Everyone talks about this existential threat and the need for us to do something urgent, and that we may be in fact late in doing it, but this can't all be about electric cars. I don't know who's buying everyone an electric car. We really need to use the next federal initiative to enable transit agencies to grow market share if we're really serious about the climate. And that's really going to require Congress to come at this in a transformative way. I think you're going to see a real tension between the desire for the Build Back Better plan to be a bipartisan effort versus the desire to do some policy changes that are truly transformative. Last year, the rather forward-leaning transit and highway reauthorization bill that Peter DeFazio passed out of the House got 0 Republican votes. It got 0 Republican votes largely because they made that bill more about climate than any prior transportation authorization bill. And if addressing climate means you lose bipartisan support, it's going to be very hard to do anything transformative in a bipartisan bill.
There's a lot to unpack there. So let's start with the equity questions and what equity looks like for the most transit dependent populations as we go forward. Beverly Scott, can we talk to you on that?
That's
To start.
well, you know, there's always going to be a need for mass transit. There's always going to wind up being so all of that conversation, that's where I kind of end up on it. The only thing I can say really on equity is that it needs to be baked in from the very beginning. I mean, we've had enough examples of when there was really systemic discrimination and racism that went into placement of facilities and definition of services. But at the same time, we understand the fact that if you don't bake the equity and if you really try to have it be like this trickle down and go running behind it and, oh, we're going to put inclusionary zoning and all that, it doesn't work. And so really having an equity centered approach on all of this, and quite candidly, what I would just say is that we're really in kind of echoing some of the things that have already been said. We're really in guiding light, North Star making times, if you will. I've been, I like the fact of what I've been hearing in terms of this administration of transformative, big and bold, because that's what it needs to be. At the same time, everybody is appreciative. We got to walk and chew gum at the same time. So I think that the bottom line is that if the infrastructure and transportation and that are not equity centered, then we will all be missing the mark. Okay. And that, and I think that's just the lens that we have to bring, that's long overdue in terms of bringing it to the work.
But Jared, what are you seeing on the equity front, particularly going forward? I know there's been a little bit of tumult in Boston with the MBTA. There were cuts and then no cuts and maybe some cuts. What does equity look like from where you sit?
Yeah, I think what it looks like is it's really got to be a back to basics approach, and by that I mean, you know, across the country you have systems who have billions of dollars in underfunded, maintenance backlogs. And that has a real impact on the reliability of buses, the reliability of trains, all around the region. And also another thing is that, we really have to look at really centering, those who rely on transit. And by that, I mean that, absolutely, if we're going to if we're going to, have mode shift, we do need to consider, suburban areas, and especially as now we have, suburbanization of the poor, and we have changing demographics in our suburbs, but we have to really look at, how much are we providing service to essential workers and to the communities that rode transit during the pandemic, because that shows you that, the pandemic illuminated for a lot of agencies, the communities and the riders that are going to be with them no matter what. And that's the places where we need to really invest in service. And in some cases, that's going to be, just simply running more buses, just having better frequency along those routes. And other times it's going to be, funding either transit expansions or on some bus routes that are continually in traffic, looking at how we can provide what we call bus priority, where you are giving the bus its own lane, where you are, working with the stoplights to give the bus priority at intersections and all of those sort of things. So it's really about, and we've stressed this with the T, who at the beginning of the pandemic did do a good job at adding more bus service onto the lines that were being most utilized by environmental justice populations and by essential riders. We want the T to continue doing that, and to not only to stop the cuts, but to build back better, and to make sure that they are providing more service for the communities who need it the most, and planning for the kinds of expansion and modernization efforts that will make transit better for those people.
Well, you make an important point about the suburbanization of the poor, and prioritizing the needs of people who've stuck with transit. There has been correspondingly a lot of talk about the work from home implications for transit. How should we rethink transit operations going forward? Things like the rush hour, which have typically been an AM rush hour and a PM rush hour, late afternoon and an early morning. How do we begin to think differently about how to provide service? Beverly.
Well, okay, so what I would tell you about that, I'm just going to say, I don't have the crystal ball in terms, and I know nobody does, in terms of what that evolution. I will commend folks to say, though, that there has been a lot of looking at what has really happened in the past when we've had these kind of things, what have really been the long-term implication. Of course, we've never had one like this. Now, I'm gonna jump out there and say, I really love the question you asked, but I'm going to say I really think that part of the conversation that we have to have is, what is the definition of what is really the value of transit? When I first started in this business, and I think that this was long overdue, when I first started in this business, and I'm not trying to be crass, I used to say our business was about butts and seats. Okay. And quite candidly, I think we have far evolved beyond that. Okay. I'm not running away from the fact that, yes, there are no question, we carry people, but our benefit and value in terms of what we provide from a societal standpoint, from a bigger standpoint, we have never done a very good job in terms of really institutionalizing that. Okay. Yes, we're directly related to healthy communities, to healthy lifestyles, to safety, to environmental. And so when we're having this conversation, yes, I'm very concerned about remote and what's going to happen with that. But I think that rather than just having this new normal evolve, like we kind of say, we need to make, that's where I go back, North Star. We need to get, what do we want at the end of the day? So do we want everybody running to SOV because, oh, now that's that's your own space, and then wind up screwing up everything in terms of land use and sprawl and all of that we know really is not a good prescription for us. So I'm not trying to duck your question, and I know there'll be others that'll be, but I'm just simply saying that if there were ever a time that we need to reset and reposition the whole thing in terms of what is a total value of transit and really have all the voices at the table, not a question to me that there's always going to be a need to move volumes of people, places. Is it going to wind up being a very different distribution in the future? Yes, I think it is. I couldn't tell you anymore. And we're, as agencies, and going to need to be a lot more agile, a lot less monopolistic. Okay, and I think things are going to be a lot more integrated than they are today.
Peter, your thoughts?
Well, I think one of the things that is lost is we already were pivoting pre-COVID to a new reality on work from home. So here in the greater, Seattle, Tacoma, Puget Sound area, we've got a lot of the major tech firms and things. Folks were going to more flexible work hours already, and we were seeing it, in the area where we most underestimated our ridership when we added in a light rail extension up to the university was not in the peak, but in the off peak. We went from longer trains. I won't get into the whole consist size, but we just had to add more capacity in the off hours to handle ridership. I expect that to continue, but it doesn't scare me. It doesn't, I think, undermine our viability. We will still be serving hospitals, the airports, the universities, sports and entertainment centers. That's going to be a really, and will continue to be an important part of our market. And I think, we will want to be able to, we have a major expansion opening every year now for the next 3 years at different stages of completion of construction. I am not sweating ridership. I expect people to come, and that's not necessarily in the most classical get to the office by 8 in the morning so they could leave by 5 at night. But if it follows similar patterns, there's going to be, dynamic movement of people of all economic groups. I also think the one thing I'd like to just amplify when Bev Scott talks about the new normal, we are one of a number of transit agencies that serve this region. We are the regional provider, do light rail, commuter rail, and bus service. We've got 3 other operators here. All of us are quite certain that we are not going back to the frequencies and route structure that we had before, that we are all going to have to take a fresh look. We're already seeing different patterns on where the transit dependent live. This has frankly been an important wake-up call, I think, for the whole industry nationwide to recognize their obligation to serve the transit dependent first and foremost. And we can see right on the heat maps of where ridership is where those communities are. But in terms of imagining the new normal, what does the new route structure look like? How are we allocating resources in the future? There's not one of us who is talking about going back to where we were.
Right, of course. Because as you say, as Jared mentioned, you have, particularly in high cost cities, Seattle, Boston, Washington, DC, people of more modest and lower incomes are being forced out.
Absolutely. And we are currently trying to construct service to get out to where they have been gentrified to. And that includes commuter rail, not just light rail.
What are you seeing on the funding front? Actually, your system is quite fortunate in that you have dedicated revenue. From your previous positions, can you look more nationwide and give us a sense of what questions communities need to ask themselves on the funding front?
Well, I was thinking about that frankly in your conversation with Muni in the last panel, because Muni has struggled financially pre-COVID. And the reason why they are so up against the wall as a result of COVID is, to my mind, the lack of adequate funding sources built into their funding structure. That's something that the city of San Francisco, its surroundings, and the state of California is going to have to wrestle with. We do have dedicated revenue, though many of those revenue sources took quite a dip in a COVID pandemic. We're hoping to be able to crawl ourselves back. But nationally, you see a wide swath of diversity. We always had this expression, Bev knows it well, if you've seen one transit agency, you've seen one transit agency, because there's no two across the hundreds across the country that are governed precisely the same, funded precisely the same, and derive the same revenues. So everyone has to figure out their own mix, and some are a lot closer to the cliff than others. And it's very tough, therefore, to create federal policies that really meets the needs of all. And that's why I think the federal government's going to need to be quite nimble in this next iteration to try to recognize what local circumstances are. We're growing ridership. We were growing ridership before COVID. We're expanding service to grow ridership. And the same is true for LA and for Austin. We are a growing population, which is the largest driver on why we're growing ridership. I heard your question in the prior panel. Well, is transit dead? It's like anything but in certain cities, though very challenged in others.
Yeah. Speaking of challenges, Jared, can you weigh in on what you're seeing in Boston? Funding has always been a tremendous problem in Boston. There was, I believe, is still talk about regional funding solutions, which, correct me if I'm wrong, still haven't really gone anywhere. Tell us what your perspective is on this question.
Yeah, right. I mean, you pointed it out exactly. Funding has always been a major issue. And I think it is that, unfortunately, sometimes the dynamic you have sometimes in older, if you'll call them legacy cities, is this sort of kind of rest on our laurels, this sort of conservative with a little c. And that is, exactly the opposite of what you see as Peter said, in Seattle, in Austin. And the message we have been trying to put out is that, we shouldn't let's put aside these questions of trying to gaze into the crystal ball and trying to figure out the future. No, either you shape the future or the future shapes you. There are forces at play that are going to shape the future of these cities. And so it either is going to be, the riders, the transit agencies, the people who care about equity, either they're going to shape the future of the city, or it's going to be, a Silicon Valley, tech billionaire who's just interested, in a quick payout and isn't concerned about what impact, the services or things that they provide are going to have on the city. And so, what we're putting forward is that, yes, new technology and delivery apps and some of these things, do have the potential to change, commuting patterns and getting around. But what we don't want is we don't want the Wall-E problem, right? We don't want, our main streets to be devoid of activity because everyone's sitting at home, getting their food and getting everything delivered. And so, as Peter says, it's about shifting to provide service during off-peak, which was already growing, and making sure that we're able to, to provide options for people who are working off-peak hours. It's, as Bev said, it's leading with equity and making sure that we are, still providing service for the folks who depend on transit the most. And it's about really just being bullish on the future of cities. We're already seeing in Boston, we're already seeing, one of the biggest architecture firms is moving from, Watertown, which is a close-in suburb, about 6 or so miles from downtown. They're moving downtown, and so they're betting on the city. And so, we need to make sure that that cities and transit agencies are doing the same thing, that they are putting a stake in the ground, and realizing that across the world, not just the cities that Peter mentioned, but Montreal is betting big on transit. And they announced that during the pandemic. Paris is building 100 miles of new subway. Cities across the world are continuing to really, bet big on cities, bet big on density and on transit. And we in America have got to do the same if we want to stay competitive.
Well, you mentioned betting big on transit, and I think President Biden calls it Build Back Better. But Build Back Better and Fix It First are strategies that are just we're just kind of keeping up, and we're certainly not keeping up with Western Europe when it comes to new lines and new ways of looking at moving people. How do we get at this maintenance backlog? The American Society of Civil Engineers, a D- for public transit. How do we get to a point that we can do basic maintenance and do new projects at the same time, with an eye, as Peter mentioned earlier, to our climate challenges?
Well, if I could,
Peter,
go ahead. I know if someone else wants to go.
No, I'll start.
Go ahead, Bev.
I was just going to say that's a resource issue, and I couldn't amen. And it's not just dollars coming in the door. The whole issue in terms of workforce is absolutely critical. If we had the money right now, and you put it right there, all of it was right there. We do not have the workforce, and I'm telling you, between public and private, that could wind up executing. And that's talking about the backlog, not on all of the new that's coming. So I'm simply saying, I mean, this whole issue in terms of the backlog and maintenance that we've had is truly, from my perspective, okay, been very, very much around simply the issue of lack of resources. Okay, it's not that people are sitting there dumb every day and don't know that they want to make sure that that bus or train gets fixed, but they've got a bus or train that needs to be fixed. They've got people saying, we need to expand service, we need to expand service, and you're sitting up and you only have so much that you can wind up doing. So to me, it's largely resources that have driven that quagmire that we find ourselves in today. Peter?
I would just, I really want to echo what Bev is saying about workforce. In fact, I just had this conversation with some of the new White House staff who were working on the Build Back Better plan yesterday. This is a very different moment than we were in when the Recovery Act was done to get people who were unemployed off the bench in the union halls and back to work. We have a very busy construction workforce right now in the at least here in the West. And there is not a vast capacity of workers skilled and trained and ready to come to work to build back better. There needs to be a workforce training component, and it needs to be aggressively equity grounded, because we can do a lot better. We are very fortunate in the Puget Sound that our building trades unions are with us in trying to diversify the construction workforce, and we have a great record of funding apprenticeships, as the unions have, to target on women and people of color in the construction trades. It would be great to model that nationally and get people into this work, because there's not a large well of people. There's a large well of people who perhaps are unemployed and are willing to come into the work. We do some programs with hiring the formerly incarcerated, but we need a training program to make sure that we can get them in the pipeline. And that's very important. On the tension between maintenance and new expansion, we do have to have both. I think especially on the climate front, you can, I don't like to say this, but it's kind of a boring topic to some, but it's something I focused a lot on when I was Federal Transit Administrator. Asset management, actually knowing which of your assets need to be replaced and how soon to get at the reliability question. You can send money for maintenance and state of good repair investments, and they might not make the smartest choices from the perspective of passenger reliability, or from the perspective, for that matter, of trying to lower emissions. There should be perhaps some policy imperatives that come with that money, and making sure that they're making smart decisions, because frankly, the state of good repair backlog is so large, it's going to be really hard to get the money, certainly to do it all. So that means we have to really pick and choose smartly, whether it be for climate, whether it be for serving transit dependent communities, or whether it's for seeing to it that we're just making smart resource allocation decisions.
So let me just ask a little bit more about this workforce issue. Are we saying that even should President Biden be successful when coming up with a very healthy package, that he's going to run into challenges making it happen?
Absolutely.
Yeah.
I mean, and this is absolutely this, okay, when everybody was running around before talking about, it's going to be $1 trillion package. This was 4 or 5 years ago. This clarion call in terms of workforce, and I want to amen Peter, because we have never elevated workforce to really being a strategic element. It is not baked into all the asset management and enterprise risk stuff that we're doing. And so that is when you bring intentionality to things that are important, okay? And so we kind of got a Burger King out there in terms of how people view workforce, what's critical, which are the core competencies, all of that. We don't even have the data sets that permit you to literally be able to look at this stuff intelligently and from a comparative standpoint across different sectors and all of that. So we got to get just like we went back in 2000, we didn't know what backlog we had until 2000. The Durbin report then was a big 7, then we did the big 9. It was 2007, 2009, 10 before the public transit nationally even could put a number around what the backlog was on the physical side. We now need to bring that same type of intentionality, focus, and rigor to the human resources, the people readiness side of the house.
And before you even get someone to tighten a single nut or bolt, the planning capacity. You know, a lot of agencies don't have the planning capacity. We've had, you know, years and years of the public sector, you know, being gutted from that planning capacity. And so that leads to, you know, that leads to projects taking longer, leads to huge cost escalations. And then, you know, we end up having, fewer projects, or we end up having projects, like I said, with huge delays and huge cost overruns. So it's, you know, it's really got to be from every single part of the agency, from planning to construction to maintenance. There's got to be, you know, there's got to be training, and there's even got to be, I mean, I think one of the things that I really hope happens with this is some research into how do we bring costs down, you know, so that we can actually get more transit built. Our transit construction costs, you know, across the country are, you know, just wildly out of proportion with, you know, with folks all across the country, or sorry, all across the world, including in, you know, in cities that have, you know, very old, you know, in New York, you often hear the excuse of, well, it's a very old city. Well, Paris isn't exactly new, or you know, Tokyo, you know, it's not like you can just open up a giant hole in the middle of Tokyo and everything's just fine and dandy. So we've got to get a handle on those issues as well.
So it sounds like, well, we heard from the other panel that the death of transit is greatly exaggerated. Public transit is going to be with us. We do need to get the workforce issues under control. We're coming down to our final minutes. What do you want to leave our audience with as we look at transit on the climate front, or on the maintenance, Build Back Better, Fix It First front, or even on the workforce front? We've got a disillusioned workforce, you know, coming out of COVID, for example, the actual people who are driving the buses and operating trains and what have you.
Well, you know, I'll jump. I don't want to in any way take away from the dire work that is needed and the resources. And I mean, you got to walk before you and chew gum before you can fly. But if there were ever a time we are dealing with 20th century lenses trying to do a 21st century job. And if there were ever a time for us to fly, I said North Star, transformative. Transportation doesn't just need to look at transportation. We need to do some integrated, holistic thinking across infrastructure. Okay, you know what I'm saying? So this is that opportunity. So I think we need to reset. We need a reset, and that reset is a future one. And that means that there's going to need to be a lot of people at the table in addition to us. But that's the future and the vision where we baked in the DEI, we do all of it, and we do it well, and we do it right. I just think we got a new script to write here, okay? And we're working off of an old script in a new world, and it don't work, okay? So that would be Bear's thought.
Peter, what's your thought?
I would echo Beverly in talking about, if we, and she is right, we can't fall in the trap of doing things the way we did them with just more zeros at the end of the new numeral in the Appropriations Act. We need to rethink how we put money out, how we collect it, and what we are giving it to localities for. And that to my mind, Secretary Buttigieg is going to be in his first hearing before Congress that wasn't his confirmation hearing tomorrow morning. And a lot of us are very interested in hearing what he has to say as to whether they're really going to reimagine federal programs from what we've been using for decades, or whether we're going to retarget them with very different imperatives and very different delivery mechanisms. I hope it's the latter, because otherwise we're just going to keep doing what we've been doing. That's what I'm going to be focused on. And I think if we really are talking about changing the landscape and how we serve people and how we grow cities and how we take care of workers, we're going to need to rethink a lot of these fundamentals.
Yeah. Jared, you get the last word.
Absolutely. Yeah. I mean, really just echoing what everyone has said and what you were saying at the top of this, Gabrielle, about transit's not dead, and we really have to realize that it's foundational, right? There are not healthy communities. There's not abundant, safe, affordable housing. There's not progress on our climate goals without strong public transit and all of the things that go along with that. You're walking and cycling. And so we really have to, we have to press our policymakers on that. We have to make sure that at the local level, we're pushing back on any talk about cuts. And as Peter was alluding to, that on our federal level, that we're really pushing our legislators to say, that the 80-20 rule, which is where we give, for every dollar we give to transportation, 80 cents of that goes to highways and 20 cents goes to transit. That's just not going to work anymore. And we've really got to push to really shift the paradigm. If we're, like I said, if we're going to try to solve some of these challenges that are far bigger than just too much traffic or the bus being late. We've really got to radically reshift if we're going to come out of COVID and build a better normal.
On that note, I want to thank you, Jared, Peter, and Beverly, for joining us today. Thanks also to our other panelists and to Congressman Jesús García for offering some introductory remarks. Hopefully your bus will not be late the next time you have to stand out in the corner and wait for it. Thank you very much for joining us for this Public Transportation in Crisis Forum. I'm Gabrielle